Hello, my name is Susan Hennigan, and this is my healthcare delivery video. The healthcare system in the United States is complex and unintegrated. It is a kaleidoscope of financing, insurance, delivery, and payment mechanisms that remain loosely coordinated. While the government does provide healthcare assistance to some, most of the financing, insurance, payment, and delivery largely remain in private hands. For a successful healthcare delivery system, two primary objectives must be met. First, it must enable all citizens to obtain needed healthcare services. Secondly, ensure that services are cost-effective and meet specific established quality standards. Understanding the American healthcare delivery system is challenging. Parts of the system, such as Medicare, are controlled by the government. However, Medicaid is controlled by states, but with federal assistance. Additionally, there is private insurance, including managed care programs and Medicare Advantage programs. Providers, who they are. A healthcare provider is a person or company that provides healthcare services to you. Most often, when referring to a healthcare provider, one thinks of their primary care provider. However, healthcare providers include physical therapists, home health companies, pharmacies, imaging facilities, laboratories, and of course, inpatient hospitals and emergency departments, nurses, and nurse practitioners. As previously mentioned, healthcare providers are not only physicians, they include phlebotomists that draw blood for labs and collect urine samples. Without the information lab work reveals, the PCP would not be able to diagnose some healthcare conditions. Likewise, the technicians who perform mammograms, MRIs, or CT scans are part of the healthcare team, providing vital information for proper diagnosis. One way to address inequality in healthcare is to increase competition. In healthcare delivery, it means that if providers of healthcare services try to attract patients who choose among several different providers. Although competition more commonly refers to price competition, it can also be based on technical quality, amenities, and the latest medical technology. Value-based procurement has been defined as an achieving outcomes that matter to people at the lowest possible cost. VBP seems to be a promising solution to improve healthcare efficiency and fairness. An overview of settings. About 595,800 establishments make up the healthcare industry. About 76% of the healthcare establishments are offices of physicians, dentists, or other health practitioners. Hospitals only constitute 1% of all healthcare establishments. In addition to the offices previously mentioned, other healthcare settings include nursing and residential care facilities, home healthcare services, and ambulatory healthcare services. The recent significant increase in ambulatory healthcare services has made healthcare more accessible if one can afford to pay for the visit. The number of urgent care centers in the community of Lake Charles has dramatically increased over the last 10 years. While the number of facilities, and therefore access, has increased, are urgent care centers any more affordable for the working poor or uninsured? Additionally, for those patients who only have Medicaid as their, quote, insurance, it's difficult to find home health care agencies that accept Medicaid as reimbursement. The same is true for nursing and residential care facilities. Finally, as Medicaid is now structured, patients can go from qualifying for it one month to not qualifying for it for the next month. Purchasers of health care include federal government, Medicare, Medicaid, employers, and individuals and families. The largest purchaser of health care is the federal government, specifically because of the Medicare and Medicaid programs. After the government, employers are the subsequent largest purchaser. Lastly, those individuals who do not have insurance through their employers, who purchase it on their own through an avenue such as the health insurance marketplace, are another type of purchasers. Self-payers are another type of healthcare purchaser. Often hospitals and some physicians will offer a cash price for services rendered. Those that can self-pay, whether due to not having insurance or just not wanting to have their insurance company involved, typically pay a lower price. Providers, while often discounting their services, still like this type of payment as it speeds up reimbursement process as well as decreases overhead by not having to pay administrative personnel to address insurance issues. How they work. Medicare is for individuals age 65 or older, or younger people with disabilities. For example, a 4-year-old with end-stage renal disease on hemodialysis qualifies for Medicare. A patient qualifies for Medicaid based on a state-by-state regulation dependent upon their income. Employers provide health insurance benefits, with the employee only having to pay a portion of the premiums. Individuals whose employers do not provide health care insurance have the opportunity to purchase their own. However, the deductible is frequently high, and to obtain good coverage or make the premiums more affordable. How each one of these address or create inequity in the healthcare process is Medicare and Medicaid help to address inequity in healthcare by providing coverage for the poor and underserved. However, Medicaid participating providers are limited, which creates an inequity in care. Eliminating indigenous and ethnic health inequities requires addressing the determinants of health inequities, which includes institutionalized racism, and ensuring a healthcare system that delivers appropriate and equitable care. Healthcare organizations and authorities need to be held accountable for providing culturally safe care as defined by patients and their communities, and as measured through progress toward achieving health equity. In addressing inequity in settings, hospitals cannot turn anyone away that needs medical care. However, inpatient rehab units, nursing homes, skilled nursing facilities, outpatient therapies, and home health agencies may not accept Medicaid. And so there really is an inequity with those patients who have that type of medical care or medical insurance. In conclusion, shifting from a traditional approach to short-term savings to a more comprehensive approach, both in terms of indicators and stakeholders, should therefore extend the benefits of healthcare to patients. Lower costs and better outcomes. Providers, which equals higher patient satisfaction rates and better care efficiencies. Payers, which equals stronger cost controls and reduced risk. And suppliers, an alignment of prices with patient outcomes. And finally, society, reduced healthcare spending and better overall health.